first episode. Going well so far. We are about to dive into the topic of the day, and that is your first budget of your term. Specifically, we're talking today about Regional 1 and that funding. So tell me a little bit about what sparked that.
So Regional 1 is this community's only public hospital. It is a community asset that's owned by Shelby County government. And so it's been around for 2 centuries, most of that time serving the underserved in this community. It has a history of being one of the only places around this state where African Americans could go for care. And the responsibility is on us, Shelby County government, as the owners of Regional 1, to make sure that the hospital is enduring for the next century. That's going to require a substantial investment because over time, the needs of the patients at Regional 1 have changed. This is the place where all of us want to go if we end up in need of urgent care, if we end up in a car accident or in a house fire, or God forbid, we're a victim of gun violence. Regional 1 is the only level 1 trauma center for miles and miles around. And that designation means it gives the highest care, highest and best care in those cases of any hospital setting that you'll find. And we want that to be available for everyone. As I said, things have changed. The volume of patients that they see over time have changed dramatically, and the standard of care has changed. And so if you were to take a tour of Regional 1, you would be struck today in 2023 to see 50 high-risk babies in a single room, where the standard of care is that you'd have a single high-risk baby in a room by itself. An opportunity for the doctors to take care of that baby, an opportunity for the family to visit with that baby, but we don't have that right now. And so we want to address that situation among many others. Right now, if you go to the trauma center, which is where you would go for the emergency type of care that I've already talked about, you'll see patients in the hallways.
Yes, we've seen that.
And that is not ideal. That's tragic. And so somebody's got to fix that, and that's on our watch. And as the owners of Regional 1, I've said that this is an opportunity for this commission, for Shelby County government, to step up to the plate and make sure this public hospital has the resources it needs to deliver care to all of us, because we never know, right, whether this is our day. Right? Those things are out of our control, and any one of us or any one of our loved ones could end up at Regional 1, and we want them to be able to access the health care that they need to stay alive and return home.
I always say it's amazing what they're able to do with what they have. They have life-saving care happening there all the time. As we speak, right now, they're caring for patients that are coming in. I think one of the other things that you talk about with this partnership and with you putting this in your budget and prioritizing it is also that partnership with UTHSC. And we are training future doctors who often come back to our community. Can you talk about that?
So that's right. If you want to grow a community, one of the things you need is you need high-quality schools, but you also need a hospital, and in an urban area, you need many hospital systems that are strong. And Regional 1 has to be strong if our community is to grow, and we're going to see the economic development that we need. And so part of the plan calls for a rebuild of the campus. That's kind of the phase 1. How do we recruit enough resources to rebuild the campus? I want Shelby County government to be the first money in because we own that hospital. Right. The other part of the plan, which is the phase 2, is how do we unlock resources from the state to support our investment? And the third part of the plan is the long-term and permanent partnership between Regional 1 and UTL Science Center. Right now, if you're going to recruit and retain the best talent in the medical profession, you've got to have the ability to give doctors and nurses and specialists dual designation. You've got to give them a clinical setting that matters, that has the best tools and innovation available, and you've got to give them an academic research setting that also allows them to grow and to progress in their professional work. And so right now, UTL Science Center doesn't have a hospital. And our hospital is looking for a real partnership for the state. So it works together. Right. And so we're hopeful that in the phase 3 of this 3-part plan, that we're able to marry permanently, every marriage is permanent,
Hopefully.
UT Health Science Center with Regional 1's campus, because that will be a game changer for the ability of that campus to recruit the very best. That'd be a game changer for our community to grow, because we'll have such a strong hospital in the middle of Midtown Memphis.
And it's right in the heart of our city, which is really important. I think to end this segment, Why should the folks at home care about this, and who should they contact to help make all this happen?
No, I think that's right. So it goes back to what I said before. It's only by the grace of God that we don't end up in a car accident or a house fire or a victim of some other incident day to day. And we never know when our good fortune is going to run out and when we are going to end up there or someone else is going to end up there. If you don't believe me, first thing you should do, if you don't believe this, is talk to your coworkers and talk to people in your family. You will find story after story of people who have benefited from the care delivered at Regional 1. Right. And so that's what I'd ask them to do, is talk to their loved ones and understand how important this moment is. And then after that, I'd say, after they're convinced, reach out to their county commissioner, because it's going to be a tough thing to get 7 out of 13 county commissioners, or, God willing, even more than that, right, to vote in support of this kind of massive investment, which will total hundreds of millions of dollars, but it's needed money to make sure that everybody gets the care that they deserve.
Well, and you said it, it's to invest in the next,
that's right,
in the next part of our community. So thank you for your work and the work you do, your whole team does in your office. And of course, this has been a fun episode 1. We're learning more about what's happening, getting a better understanding of. Contact your commissioners to support the budget. And we've got our next segment.